Section 4 already. You're cranking. Now, a look at dive accessories and a bit about health for diving. After that, we'll go over the issues surrounding breathing air at depth and finish up with the confined water dive preview for your 4th confined water dive. You're familiar with the major components of scuba gear. Now let's take a look at the accessories that make diving more fun and go more smoothly. When shore diving and sometimes boat diving, you may tow a surface float. Surface floats give you a place to rest, provide flotation if there's a problem, carry accessories, and fly a dive flag. They also mark the dive site if you want to return after a surface interval. Sometimes you anchor your float and then stay near it. Sometimes you tow it to cover a wider area. If so, use a reel or line caddy to avoid entanglement, and don't attach it to you. That way you can simply let go if something snarls the line or a boat drags your float. You often use your surface float for flying a dive flag. Places popular with divers are often popular with boaters, skiers, and other water sports enthusiasts. The flag lets them know you're there, and for safety, local law often requires you fly one. Which of the 2 dive flag types you fly depends on where you are, and sometimes you may have to fly both, especially when boat diving. Local regulations may stipulate how close you have to stay to your flag and how far boats stay away. If no laws apply, stay within 15 meters, 50 feet. And boats should keep off 30 to 60 meters, 100 to 200 feet. But don't assume boaters see or recognize your flag. If you hear a boat engine, stay down until it passes. Even then, surface cautiously near your flag. You might think you only need a dive light at night, but they're useful during the day too, for looking into cracks or for revealing colors on deeper dives. Slates cost little and take up almost no room, yet they're the easiest option when what you have to say is too complicated for hand signals. Typical slates fit in your BCD pocket, though some kinds ride on the back of your console or your wrist. There's nothing more frustrating than missing a dive because you break a fin strap or something without a spare on hand. To avoid this angst, carry spares for those things that get lost or worn out, along with some basic tools in a watertight box in your gear bag. You'll be surprised how often your kit makes the difference between joining the fun or just watching it. Your open water diver certification card is like a diploma. It indicates that you've completed entry-level diver training. Your logbook is like your resume. It tells dive masters and other professionals what you've done with that training. Logbooks provide proof of experience often requested for diver training, and when diving at resorts or on charter boats. You want a logbook so you remember your dive experiences, to document your diver history, and to note specific details for future reference. Diving's relaxing, but not sedate, so you need to be in good health. Although you plan your dives to avoid overexertion, at times strenuous activity becomes part of it, and you need sufficient health, fitness, and conditioning to handle it. Good health includes good habits. Avoid alcohol, drugs, or tobacco prior to diving. Alcohol and some drugs can impair your judgment and may increase your risk of decompression sickness. Consume alcoholic beverages conservatively the night before diving to avoid dehydration, which may also contribute to decompression sickness. If you take a prescription drug, discuss its effects with your doctor. If in doubt, don't dive until you're no longer using it. Smoking is undeniably detrimental to your health and can interfere with an active lifestyle. If you do smoke, abstain for several hours before and after diving. Smoking theoretically raises your risk of lung overexpansion injury, even when you breathe normally. Don't dive if you don't feel well, including a cold. Diving with a cold can cause equalization problems and possible ear or sinus injuries. And diving with a chest cold can trap air, risking lung overexpansion injuries. Wait until you're well. Don't try to use cold medications to make the dive. Have a physical exam when you start diving, and at least every 2 years after. Maintain your physical fitness and keep immunizations, especially tetanus and typhoid, current. Eat and rest adequately. You don't have to be an Olympian, just in good average health. Dive health includes keeping your skills and knowledge sharp. The best way is to dive as often as you can and try new activities and visit new places. If you're away from diving for a while, no worries, it happens. Review your PADI Open Water Diver course materials and see a PADI dive center or resort about the Scuba Review program. Scuba Review refreshes your knowledge and skills, and you can usually do it in an evening or morning. If you're a woman, you may be concerned about menstruation or pregnancy. Menstruation shouldn't keep you from diving if it doesn't normally keep you from other active recreations. There's not much known about how diving affects a developing fetus, however, so the recommendation is to not dive while pregnant or trying to get pregnant. So far, you've learned a lot about the direct effects of breathing air underwater, such as why you need to breathe slowly and deeply and never hold your breath. There are also some indirect subtle effects that can cause problems. Fortunately, you can usually avoid these by following some simple guidelines. To understand these effects, you need to understand that air is 79% nitrogen and 21% oxygen. Your body uses oxygen but doesn't consume nitrogen. The air you breathe while diving is the same as the air you're breathing now, except it's filtered to remove impurities and moisture. The first possible, though rare, problem is contaminated air. This can happen when there's a problem with the air compressor or its filtering system, often resulting in air that smells and tastes bad. Fortunately, contaminated air is rare because dive operations recognize the seriousness of contaminated air and have their air tested frequently. Avoid these problems by only having your tank filled by professional dive operations. Never fill or attempt to have your tank filled by anything other than an air compressor system specifically designed for scuba diving. Never dive with air that tastes or smells bad, even if you filled it at a proper air source. And contaminated air can be odorless and tasteless. If you feel ill or get a headache while diving, end the dive. Divers breathing contaminated air may experience headaches, nausea, and even unconsciousness. They may have cherry red lips and fingernail beds, though this can be hard to see underwater. Give someone suspected of breathing contaminated air emergency oxygen and rescue breathing if necessary. Contact medical attention for the diver. If you suspect contaminated air, save the air for analysis, but don't dive with it. Another way you can suffer from contaminated air is by breathing exhaust fumes aboard a boat. Stay in fresh air to avoid this. Recreational divers sometimes use enriched air, also called nitrox, which has more oxygen than air does. This lets you stay underwater longer at certain depths, but enriched air can cause oxygen problems within recreational diving limits. For this reason, you need special training and certification to dive with enriched air. Don't dive with enriched air or try to have a cylinder filled with enriched air until you're trained and certified to use it. Although your body doesn't use the nitrogen, nitrogen becomes intoxicating under pressure, generally first noticeable around 30 meters, 100 feet, and becoming stronger as you go deeper. This is called nitrogen narcosis. Narcosis isn't directly harmful, but it impairs coordination, judgment, and can create a false sense of security. It can cause a disregard for safety and foolish behavior. The hazard is that these symptoms can lead to accidents or hamper responding properly to an emergency. If you feel nitrogen narcosis or your buddy acts impaired, Ascend to shallower water. It diminishes quickly. You avoid nitrogen narcosis by avoiding deep dives. You've already learned that you have underwater time limits beyond those imposed by your air supply, comfort, and fatigue. These limits relate to nitrogen gas dissolving from your breathing air into your body tissues during a dive. This is caused by the increased pressure you're under. The two primary factors that determine how much excess nitrogen you absorb are how deep you go and how long you stay. Deeper and/or longer equals more nitrogen. Ascending takes you to lesser pressure, and the excess nitrogen begins to come out of solution and leave your body. Your body doesn't use nitrogen, so what goes in must come out. As long as you keep excess nitrogen within reasonable limits by properly using dive tables and dive computers, the excess nitrogen normally leaves your body without complications. But if you exceed established depth and time limits, the nitrogen comes out of solution faster than your body eliminates it, causing bubbles to form in your tissues. This causes decompression sickness, sometimes called the bends. Though time and depth are your primary factors influencing nitrogen absorption and elimination, secondary factors include fatigue, dehydration, vigorous exercise, cold, age, illness, injuries, alcohol consumption, and being overweight. Besides these 9 factors, diving at altitude and flying after diving have special considerations you'll learn more about in Section 5. Therefore, you always want to dive well within the limits of your dive tables or computer, and use extra caution if any secondary factors apply to you. Make a habit of leaving a conservative margin between your actual dive time and how long your table or computer says you can stay. Bubbles can form anywhere in the body, so decompression sickness symptoms vary widely. They include paralysis, shock, weakness, dizziness, numbness, tingling, difficulty breathing, and different degrees of limb and joint pain. In the most severe cases, unconsciousness and death are possible. Signs and symptoms may also be subtle, including a mild to moderate dull ache, usually but not necessarily in the joints. Weakness, lightheadedness, and prolonged fatigue may be symptoms. Symptoms usually occur between 15 minutes and 12 hours after a dive, and tend to come on gradually and get worse. No matter how mild the symptoms, consider possible decompression sickness serious. Lung overexpansion injuries and decompression sickness, while having different causes, produce similar signs and symptoms. Together they're called decompression illness because you don't need to distinguish between them when assisting a diver. First aid is the same as you learned in Section 3, including having the diver lie down and breathe emergency oxygen. Contact local emergency medical care and the local diver emergency service if available, or the closest recompression chamber. Monitor the diver for breathing, pulse, shock, and provide rescue breaths and CPR as needed. Lay an unresponsive breathing diver left side down, head supported, and breathing oxygen, like you learned in Section 3. Don't delay first aid in getting the diver to treatment, which requires recompression in a chamber. The faster treatment begins, the lower the risk of permanent residual symptoms. Although decompression sickness is a serious condition, you reduce the risk by properly following established safe time and depth limits. You avoid lung overexpansion injury by breathing continuously and never holding your breath. Part of avoiding both includes making a slow ascent, with a short pause at 5 meters, 15 feet, called a safety stop. You'll learn more about these in Section 5. If your body tolerates only a certain level of excess nitrogen, how do you know what that level is, and how do you stay within it? By guessing? No, you use dive tables and computers that express a mathematical decompression model developed to track the theoretical amount of nitrogen in your body. But keep in mind that you're applying a mathematical model. Theoretical models can't account for individual variations, so stay well within the limits predicted by your tables or dive computer, especially if any of the secondary factors you learned apply to you. Remember, because people differ in their susceptibility to decompression sickness, no dive table or computer can guarantee that decompression sickness will never occur, even though you dive within the table or computer limits. Plan your dive well within limits and the risk is minimal. But the only way to avoid all risk is to not go diving. As a recreational diver, you plan all your dives as no decompression dives. This means you can always ascend directly to the surface without having to stop, yet without significant decompression sickness risk. This is also called no-stop diving because you don't have to stop, though you usually will for extra conservatism. Dive tables have been around since 1907 and were the primary dive planning tool until the rise of dive computers in the 1980s. Although you'll use computers most of the time, you still learn to use tables. First, because it helps you understand what your computer does, and second, because computers can fail. If you have tables, you won't miss out on all the fun. Most dive tables were designed for military or commercial diving. However, you'll be using the Recreational Dive Planner, RDP for short, the only dive tables designed and tested exclusively for no-stop recreational diving. You'll learn to use either the table or the wheel format of the RDP. Dive computers do the same job as dive tables, and they do it the same way, by calculating how much nitrogen you theoretically have in your body. They're no more or less valid than dive tables. So don't let the electronics, displays, and digitals impress you. The computer's advantage is this. Being printed, dive tables provide a series of dive profile approximations that you fit your actual profile within. A computer, on the other hand, integrates a depth gauge, timer, and software to write a custom table for your exact profile, updating it as you go. Computers are more convenient to use and help minimize human error. Dive tables have to assume you spend all your time at your deepest depth, but computers give you more no-stop time on a multi-level profile by crediting you for time at shallower depths. The wheel version of the RDP lets you get multi-level credit too, but not as precisely as a computer because computers follow your profile more exactly. Computers track your nitrogen levels throughout the day, which isn't difficult with tables, but computers do it automatically. Computers have disadvantages, the primary one being that they can fail before, during, or after a dive. So be sure to have tables along for backup. Computers will also provide numbers for dive practices that aren't recommended, so don't turn your brain off when you turn your computer on. And computers give more no-stop time by eliminating rounding, but you give up the extra conservatism rounding provides. But given the advantages, it's more unusual to see a diver without one than with one. This is why it's one of the first pieces of equipment you'll want to invest in. You'll learn more about diving effectively with a computer in Section 5. Dive tables and computers tell you your maximum dive time without required decompression stops, the no decompression limit, but they also account for nitrogen you absorbed on previous dives. This is because when you surface, you have excess nitrogen in your body from the dive. This is called residual nitrogen. In theory, it takes several hours, even longer than a day sometimes, for all the residual nitrogen to leave your body. If you make another dive while you still have residual nitrogen, you're making a repetitive dive. You have to account for the residual nitrogen in your body when determining your no decompression limits for a repetitive dive. Before your first dive, your nitrogen level is normal. After your dive, you surface within accepted limits, but you've got more nitrogen than normal. During your surface interval, your body eliminates some of this nitrogen. But if you make a repetitive dive, your nitrogen level equals the nitrogen left from the first dive, plus what you absorb on the repetitive dive. The recreational dive planner and dive computers allow you to track changing theoretical nitrogen levels so you can determine your allowable no-stop dive time. How long you have to wait before a dive isn't considered repetitive, depends on the dive table or computer. With the RDP, if you don't plan to dive for 6 hours, residual nitrogen has little consequence. If you do dive within 6 hours, you have to account for the residual nitrogen, which is pretty easy with the RDP. You'll learn to use the Recreational Dive Planner with the Instructions for Use study booklet that comes with it. Before you get started, let's go over the general rules you follow when using the RDP. Bottom time is the total time in minutes from when you begin your descent to when you begin a direct ascent to your safety stop and the surface. Some divers time from descending to surfacing, which is fine, because it's more conservative than the true definition of bottom time. Plan dives shallower than 10 meters, 35 feet, as though they were to 10 meters, 35 feet. Use the exact depths and times shown on the RDP. If your dive falls between shown depths, use the next greater depth and/or time. Ascend at 18 meters, 60 feet per minute or slower. Slower is fine. Be a safe diver. Slowly ascend from every dive. Be conservative and plan your dives well within the RDP limits. Avoid the maximum limits shown. When planning a dive in cold water or under strenuous conditions, plan your dive as though it were 4 meters, 10 feet deeper than it actually is. Plan repetitive dives so they're to an equal or shallower depth than the previous dive. The vast majority of scientific data about decompression is based on deep to shallow planning, so diving this way keeps you within profiles with proven reliability. Limit your repetitive dives to 30 meters, 100 feet or less. Limit your depth to your experience and training. For newly certified open water divers, 18 meters, 60 feet. 30 meters, 100 feet is the recommended general limit. With 40 meters, 130 feet, the absolute maximum limit for recreational divers who have the experience and training required. Plan your dives well within RDP limits. Note that 42 meters, 140 feet appears on the RDP for emergency purposes only. Don't dive that deep.
Done that about 85 times.
By now, you're pretty comfortable in the water. Good. Let's take a look at what you'll be doing in your fourth confined water dive. For starters, you'll be doing some stuff without scuba gear. Skin diving. Why, you ask? Because skin diving goes hand in hand with scuba diving all the time. It's an easy way to scope out a potential scuba site fast. Or the water may be so shallow, you don't need scuba. You'll use the same gear you use for scuba, except the scuba. And you'll either use a bit less weight than usual so you're positively buoyant, or you'll wear a snorkeling vest. Without a tank, you obviously hold your breath when you swim down to look at something. To extend breath hold time, you can use hyperventilation, which is simply taking 3 or 4 rapid, deep breaths before holding your breath. Hyperventilation reduces the carbon dioxide in your system, and since it's carbon dioxide that stimulates breathing, you can go longer before you feel the urge to breathe. But hyperventilate no more than 3 or 4 breaths. If you do more, you can blow off so much carbon dioxide that your body runs out of oxygen before you feel the need to breathe. This would cause you to black out without warning and drown. Don't hyperventilate excessively. And rest a minute or so between dives. If you feel fatigued, dizzy, or lightheaded, stop diving down and catch your breath at the surface. Since you're holding your breath while skin diving, you want to go down fast with minimal effort using the head-first surface dive. Goes like this. Deflate your snorkeling vest if you're using one. Then swim like this, hyperventilating 3 or 4 breaths at the same time. Hold the last breath, bend forward and thrust your legs straight up like so their weight drives you down. Kick when your fins come under, equalizing like you do with scuba as you head to the bottom. As you come up, look up, reach up, and be sure you have a clear view so you don't run into anything. Your buddy waits at the surface while you're down, and vice versa. That's so he's got a fresh breath if he needs to come down to assist you. There's an easy way to clear your snorkel when you come up from a skin dive, called displacement clearing. Note that when you look up, the snorkel tips lower than the mouthpiece. Exhale through the final few meters or feet, and the air pushes the water out of the snorkel. Keep exhaling as your head rolls forward at the surface, and hey, your snorkel's clear. But this only works if you have a snorkel with no self-drain, or a small self-drain valve. If you have a bigger valve, the air bubbles out instead of clearing the snorkel. No big deal, though. A valve that big means it's super easy to blast clear anyway. After you've skin dived a bit, your instructor will get you back into your scuba. You may practice the sitting back roll entry, which is great from a low, unstable platform like a small boat. Sit at the edge of the platform, make sure all your gear's in place, put some air in your BCD, check the entry area, then lean back while holding your mask and breathing from your regulator. Keep your legs tucked so your feet don't smack the edge. You might feel disoriented a moment, then you pop up. Let your buddy know you're okay and clear the entry area. You already know how to remove and replace your mask, so now you'll practice swimming without it, like you might if you had to surface after losing it. Remember to breathe through your mouth and exhale through your nose if you feel water tickling it. Open your eyes. You'll see well enough to swim. If you're wearing contacts, don't. Let your buddy guide you so you don't lose them. Okay, time to demonstrate what a pro you become with buoyancy. You're going to hover motionless for at least 30 seconds without using your fins or hands. Start by getting neutral on the bottom. Then gently push away from the bottom a short ways. Don't hold your breath, but use your lung volume to maintain your depth. If you begin to rise, breathe with your lungs a bit less full, or a bit more full if you start to sink. It helps to find a visual reference, like a mark on the pool wall, to gauge where you are. Practice, and it's easy. Confined Water Dive 4, here we come!